you in the queue so that you may have the opportunity to ask your questions live. To participate online, type in your name and a question in the fields below the streaming player, press the Submit Question button, and your question will come directly to us. Stay with us through the hour and you will learn useful tips to help you live well on your journey with diabetes. In addition, we invite you to provide us with your feedback in a survey at the end of the event. So please stay with us. Okay, now a little bit about why we're here today. Because of the link between diabetes and heart health, the American Diabetes Association, in collaboration with the American Heart Association, has launched No Diabetes by Heart. With support from founding sponsor Novo Nordisk, as well as national sponsor Bayer, the No Diabetes by Heart initiative provides tools and resources for people living with type 2 diabetes to learn how to reduce their risk of cardiovascular disease. As part of the initiative, the ADA is holding this free educational Q&A once a month. We'll cover information and tips to help you take charge of your health. When you have diabetes, it increases your risk of heart disease and stroke. Make sure when you see your doctor, you talk about your risk and work towards prevention. Okay, I am very happy to introduce our guest speaker today, Amy Hesh-Fischel. She has been on before and she's awesome. Amy is an advanced practice dietitian and diabetes care and education specialist for the last 20 years. She works at the University of Chicago Kovler Diabetes Center with both adult and pediatric endocrinologists, sharing the same clinic to more effectively allow transition care throughout the lifespan. She helped create In Transit, the teen transition program at the Kovler Diabetes Center, and has overseen transition care at the clinic for the past 15 years. And she strongly supports being a self-advocate for your diabetes care. So, Amy, do you have anything to add to that?
No, I think you covered it all. It's just such a pleasure to be here today and hear some of the things that is the struggles that all of you folks are dealing with. Diabetes is a marathon, not a sprint. So we know that there's so many things that go into self-management. And I am, as Carla said, I'm a really big advocate for everyone to be, the the cheerleaders of their own care, and that it's a collaboration when it comes to diabetes self-management.
And I really think it's become more and more so as the years have gone on. It used to be we sat back and listened to what we were supposed to be doing, which we still need to do. But I think the collaborative approach is so much stronger now.
No, absolutely.
So
Interesting. Oh, I'm sorry. Go ahead,
go
Carla.
ahead.
Oh, no, I was just
Go.
going to say that when we think of, that collaboration or patient-centered care, we've actually been talking about it since the late 90s. But, I think that it's becoming more mainstream over the last decade. So it's interesting because when I think of, I take my mom to her doctor appointments and, I'm the one that's asking the questions because again, she's of that age of, again, yes, we listen to what our healthcare provider is telling us instead of kind of engaging in that conversation. And I think that we really do need to kind of really move forward for all of us to be engaging more often into that discussion because it's a more rich kind of collaboration because it's about you. I don't ever want somebody leaving after they see me and like, well, I'm not going to do that. I'm just going to go back and do whatever. I would prefer that someone says, I'm not really comfortable with that. Can we think of, do something else? Can we talk about something else that may take the place of what you're proposing? So I think that, it takes practice to do that. But, again, it's important that you're very honest and having those discussions with your healthcare provider. And remember that, we're all professionals, that, again, no one's going to be mad at you for voicing your opinion because you are the one that's living with this 24/7.
And if they are mad at you for voicing your opinion, it's time to think about another care provider because you want them to be engaged in your care with you, right?
No,
So, thank you. Yeah. Okay, so thank you. If you're just joining us, welcome to today's Ask the Experts Q&A Self-Advocacy taking your lead in your diabetes care. As a reminder, for those of you on the phone, press *3. That's *3 on your keypad, and an operator will collect your question and place you in the queue so that you may have the opportunity to ask your questions live. To participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button, and your question will come directly to us. Remember, today's topic is how to take the lead in your healthcare, what to discuss with your diabetes team. Let's remember to focus on that topic today. So let's go ahead and take our first question. So we have some interesting questions here, but I'm going to start with this one right here. This is Anne Marie, and this is a perfect one for a dietitian working in the field. So here we go. Well, except there we go. So Anne Marie, you're on.
Yes. Hello?
Hello.
Yes. Hi. I just asked a question to someone who was on the line. Anyway, yeah, my problem is like my sugar go up and down. Like yesterday, it was 137 at 11 o'clock, 11 a.m. This morning, I barely ate yesterday. I had breakfast and then I had a yogurt around 6 o'clock and some corn with some tomato. But this morning when I checked it at 6 o'clock, it was 158. So seeing that I didn't eat, well, not a whole lot, how come it went up that high?
Great question, and Happy New Year.
Thank you. A healthy, happy, and blessed one to you too.
Likewise. You bring up a really, really important concept that so many people really just think that what they eat is the only thing that impacts their blood sugars. And that's actually not true. One thing that we have to think is that, yes, food itself does impact blood sugars, but only for a short period of time. And when we eat, it's going to be impact our numbers just over the next few hours. So it's not going to have an impact on your numbers 24 hours later. That is the beautiful thing about diabetes, that there's so many things that are happening in your body that's causing your blood sugars to kind of vary. One really important thing that we do see in type 2 diabetes is that the liver, which stores all of our sugar for use throughout the day, overnight, it tends to give people with diabetes a little too much. And so that may very well be contributing to your rise in the morning. But, just the lots of the different physiologic things that are going on in your body with diabetes are contributing to that. Not your food that you ate before, but I do want to impress on one thing that you just said, is that you didn't eat that much. And I certainly want to discourage people from just starving themselves, because that's not necessarily going to impact their blood sugars in the long term. You want to be eating healthfully. But again, just remember that when we eat a meal, it's only going to be affecting our numbers for a short period of time. Now, this kind of rolls into our topic today of what should you be talking to your doctor about. And I think, my dear, this is a very, very good conversation that you should be having and saying, doctor, what should my blood sugars be before meals? What should they be before I actually eat for the day? Why might my numbers be in this range or outside of the range that you are recommending for me at these times? And what can I do, or what medicines am I taking or should I be taking that may be affecting my blood sugars overall? So, again, these are just some nice specific questions that you can be asking your doctor, focusing on this specific question. Because again, remember, diabetes is a very individualized condition. And we know that everyone is going to have kind of different needs. But those are some really big questions that I do want you to ask your healthcare provider. But thank you so much for that question.
Thank you. We have a question coming in from Jane. Jane is from Texas.
Yes, I'm here.
Hello, Jane.
What is your question?
Okay, as I said to the lady, I'm Jean. I am 76 years old. I've been a diabetic for about 5 or 6 years. I'm on metformin, okay, and I take I take 1,000 with my evening meals, okay? But it seems now that my numbers are never what they used to be, even taking meds with my meals. So I'm not sure if my doctor did tell me my last visit. I asked him, I said, now let me ask you this. Are my numbers supposed to be right where they should be? I know what that is. I say, but they're not that anymore. He says, I say, does metabolism, what it has to do with it at a person my age? And he says, well, you know what? Your numbers probably never going to be what they used to be at your age. Don't look for them to be from 88 to 120 or whatever that is. I know those. I used to work healthcare. But so my question is this. Do you think it's time for my meds to be changed to something else? Maybe metformin is not working as well. And then I have a problem with changing because I want to know what is happening to my body when I get something that is so different. I have an appointment next month, and we'll have a good discussion then too. But if there's any light that you can be shedded on this situation, age, he tells me not to deny myself of anything. That doesn't mean that I'm going to eat a whole cake, which I'd love to do. But I do eat some things that I wouldn't normally eat. So can you give me some advice or tell me something?
Of course, Jane. First, of course, as I said before, Happy New Year. And you are indeed a youngster. So again, I think that having diabetes for 5 or 6 years, and even at your age, when we think of what are the recommendations of where your blood sugars should be, under 130 pre-meals, and when we think of kind of the A1C, that average glucose, that is that blood draw or point of care that's done every 3 months, we want that A1C under 7. So again, when you have that discussion with your doctor, and as he said, your numbers may not necessarily be non-diabetes anymore, but they should be, within that general range of everyone else. But I would say I would take that one step further and kind of, ask him what are the ranges that you need to be in, and to reduce your risk of long-term complications. Because again, like I said, you're young. We want to make sure that you don't have any long-term complications over the next 10 years. Again, I'm foreseeing, you're going to be living well into your 80s. So, again, I think that that's important that you have that discussion. But to your question, the longer that someone has diabetes, the more help your body needs. And so I think you answered your own question of, do you need additional medications? And we do tend to see that people with diabetes, if they're not within the range of, their goal ranges, and their A1C is not within 7%, again, there is going to be a higher likelihood that you're going to need more medicine. But you did mention something, that metformin, that you're only taking 1,000 milligrams, once a day. That's actually not maximum dose. So I think that, some questions that I see coming, and I'm so happy that you have your appointment soon, is asking doctor, am I on the maximum dose of metformin? And do you think that even, taking maximum dose is going to help? So that's going to be question number one that you can ask. But I do think that, finding out, the other questions that I said, what should your blood sugar goals be pre-meals, and what should your A1C goal be? And how does he see your, what medication changes need to be made to get you to that? So there are a lot of medicines that are available, and I am not going to pretend to be your doctor, because again, and since I don't know everything about you, I don't want to give any specific recommendations, because again, I want to make sure that's left for your doctor. But again, there's a lot of different options. Cost is a a factor that we have to think about, co-pays, all of those things. So I do think that you want to have a conversation with your doctor of what are the current medications that we should be considering, and what are those, what kind of side effects could be part of those medications, and again, what else should I be doing? Now, certainly it goes without saying that, as you said, um, we all are not going to eat, 100% healthfully every single moment of every day. Again, life is meant for living, and we want to make sure that we are including some little indulgences every once in a while. And again, that's important. That, like you said, you're not going to eat a whole cake, but having a piece of cake for your birthday, or your family's birthdays. Again, that there's nothing wrong with that. We just have to balance all of those things out and making sure that we're being active. But I think that it is important that having that discussion with your doctor about the other medications that you could be taking, especially if you are already being active, and 75 to 80% of the time you are following a kind of healthful meal planning recommendations, and making sure that you're not having too many carbohydrate at one time to affect your blood sugars. So again, I'm going to stop there, but I think that you do have a wonderful, robust conversation that you're going to be able to have with your doctor. And it sounds like you do such a wonderful job of really collaborating with your doctor as well. So I want to commend you for that, because it's really important that you're having these discussions, these honest discussions with your healthcare provider.
Thank you. So I have a question coming in online. I am an adult diagnosed with type 1 diabetes a year ago. My endocrinologist has 15-minute appointments every 3 months, mostly focused on my exercise and diet. And if I want to move to a pump, but not much else, what else should I ask, especially since she's mostly treats people with type 2 diabetes?
Okay. So it's sounding like you're someone with type 1, and again, 90% of the people I work with are type 1, and so again, near and dear to my heart. And it takes a lot of time to really have these discussions. I think that Carla and I are diabetes care and education specialists, again, working with people with diabetes. And, that this is one of my biggest jobs. I'm working with folks and helping them kind of navigate things of what they want to talk about. So I do strongly encourage that you talk with your endocrinologist to find out if there's a diabetes care and education specialist who works with type 1 diabetes that you can collaborate with on a regular basis. Again, I want to be clear that for Medicare, when we think of the coverage of diabetes self-management education and support, 2 hours of DSMES every year, 2 hours of medical nutrition therapy. Most commercial insurances are the same. So again, these are covered benefits that I do strongly encourage that you take advantage of. But again, I think that you are in the same boat as a lot of people. The providers don't have as much time to be able to really delve into some of these things. And so that's where, again, it is great to be able to collaborate with a diabetes care and education specialist. So, again, I think your number one question for your endocrinologist is, I'd like to be able to spend a little more time talking about some of these topics that are important to me. And again, can they refer you to a diabetes care and education specialist? But, again, certainly you're more than welcome to ask these questions of, what is it that's important to you? And those are the questions that I want you to be posing to your endocrinologist. If you're not ready for a pump, again, this is a personal preference for people with diabetes. Again, I know that there's a value to pumps, continuous glucose monitors, but again, it's really important that you voice your concerns, what your opinions are about where you are in your diabetes journey at year 1. So again, that's where I would start. But again, certainly being able to collaborate with a diabetes care and education specialist who focuses on type 1 is going to be a really valuable thing for you as well.
Yeah, I agree with that, Amy. I think the other thing is you mentioned that your provider, I'm not sure it's an endocrinologist, but if it is, great. But I think when you have type 1 diabetes, it is truly a little different than type 2. It's actually a lot different than type 2. And I think it's important to have a provider that understands type 1. So you might consider that as well, is saying to your provider, I really want to talk to someone that knows a lot about type 1 diabetes in general. So just another thought is you could do that as well.
Yeah, no, great,
Okay,
great,
so
great point.
yeah. I mean, there are there are quite a few providers that specialize in type 1, and I do think that's the place to go. And I think it's challenging when you're diagnosed as an adult too, because so often it's considered almost like a type 2, and it's not. It's a very different disease.
And
Okay,
one
so we
thing,
have a question. Yeah.
I'm sorry, Carla. I wanted just to comment on, it right now, at least for a little while longer, we know that healthcare providers, physicians, nurse practitioners, still are able to do telehealth. And depending on where you live in the country, there may be some, rules that, allow you to kind of see another healthcare provider across state lines. So I'm not saying I want you to jump ship and leave your state and see another endocrinologist somewhere else. But again, this is really a great opportunity to take a look at like JDRF, ADA, some of the support groups that are for type 1. Find out who, what some of those type 1s, who they're seeing, but also, again, maybe doing a virtual visit with, a healthcare provider who handles type 1. Maybe a really great opportunity right now. But again, definitely talking with your current provider and finding someone who's going to be able to be a better fit and maybe spend a little more time with you. Sorry, Carla. Go ahead. Next question.
No worries. No worries. Okay, we have June on. June is from Georgia. And June, you're on the line.
All right. Can you hear me?
Yes, ma'am.
Yes.
Okay. My question is, I am a type 2 diabetic for the past, I think, 2 years. And my question is about pasta. I have this recipe that I love to make. It's called macaroni casserole. But I know it said pasta. You can't eat pasta. Can you eat it? Some say you can. What can I substitute in this recipe for pasta? Instead of using pasta,
Well,
what can I use?
sure. Well, hello, June. Happy New Year. Welcome. There is a misconception that pasta isn't allowed with someone with diabetes. One thing that's really important, it's not the what, it's the how much. So again, remember carbohydrate, the volume of carbohydrate that you're consuming is going to have the biggest impact on blood sugars. But I want to step back and say, everyone is very different as to how much that they can, how much their body can actually tolerate. So it's important that you take a look at, this macaroni casserole sounds delicious. Assessing how it impacts your blood sugars, looking at your, what is your blood sugar before you start eating. Again, like I said, the goal for most people is under 130 at that time. And then what's your blood sugar, say 2-3 hours later? Again, the current recommendations for, 1 hour after a meal under 180, around 2 hours later under 140-ish, somewhere in that range. Like I said, everyone is going to be different, but that might be a really good way for you to assess. All right, you have a scoop of your macaroni casserole on your plate. Like I said, it's about the volume that you have. So macaroni or any pasta is not taboo, but again, we need to really focus on, again, how much that you're having. I would also there are some alternatives. They're just not going to taste the same. So, again, there are alternative pastas that you can have. But I would maybe pose, taking a closer look at your recipe and, can you add more vegetables to it? Again, because it's all about, like I said, the volume. Again, you can have a bigger scoop with less pasta in that scoop, but more vegetables and, some of the meat and all of those things. So, I would really take a closer look at, can you adjust the recipe to include a little more non-starchy vegetables in there that's going to kind of, literally, help it be a little more healthful as well. But there are other alternatives that you can use. They just may not taste the same.
Thank you. So we have a question coming in from Debbie. And Debbie is from Wisconsin.
Happy New Year, everybody.
Happy New Year, Debbie.
Good to you.
Thank you. My question is this. I am a type 2 diabetic. I've been diagnosed, just like the lady in the previous call, for about 2 to 3 years. And I'm diet controlled, which is awesome. My A1C has been 6.6 to between 6.3 and 6.6 since I was diagnosed, which is really good. But my doctor told me at my last visit that if my blood sugars go up so that my A1C is above 6.8, he will put me on metformin. Here's my question. I had my A1C done beginning of November, end of October, something like that. And then about a week or two later, I had my knee replaced, and I was on Norco for pain every 4 hours, and it was horrendous. My blood sugars have gone from the low 100s to 120s, up to 126, maybe 127 on occasion prior to the surgery, to 160 to 200 after the surgery. I have weaned myself off of the Norco, the narcotic, which I'm very grateful for, and substituting Tylenol arthritis when I need it in the morning, and I still take the Norco at bedtime. And my blood sugars have come down recently to, I'm doing laundry and my timer went off, never mind. Sorry. So now my blood sugars are down to the 120, 130 range. And I'm wondering, did I hit it on the head where it was related to the Norco, or was it the pain that caused it? Or I'm seeing my doctor on Thursday, and I'm still in therapy quite routinely. So I'm doing everything I'm supposed to be doing in therapy to get the knee to bend, and it is. I'm up to 108, normal is 110 flexion. So am I on the right track, or do you have a suggestion for something else?
No, you are on the right track, and you actually hit the nail on the head. Any stress on our body, so that surgery and the subsequent pain, contributed to your blood sugars rising. So, again, certainly I have a feeling that you can, now that you have your appointment with your doctor on Thursday, you can negotiate a little bit that, that short term of when you were, this surgery and all of that is going to contribute to your numbers being slightly higher. So your A1C may be a little bit higher, but I think that you could negotiate a little bit more. Now, one thing that I did want to mention is that it's not failure if your doctor does put you on metformin. Again, I think that metformin being a drug that has been used for so very long, it's kind of the least innocuous of all of them that are out there. And it really does kind of, the bigger thing that it does, most people take it kind of with their meal to reduce the risk of their, the GI distress that it can cause, usually the later meal, because again, it's going to help suppress the liver from kicking out too much sugar and helping those morning numbers a little bit more. So there's no shame in your doctor starting that, but I really feel that you are on the right track now that, of course, you've gone through PT, you're doing this, you're going to be increasing your activity. That alone is going to kind of bring you back to where you were. So I wouldn't necessarily stress too much about that either way, but I do feel that, yes, what you went through contributed. And then, of course, it was the holidays, too, that kind of contributed to. But, again, I think that whether your A1C is 6.8, again, even the addition of metformin is not a detriment to you in the long term. So I do want you to, all of you on the, call or even, listening in today, your glucose levels, are just that, they are just numbers. They are not you. I don't want you to be, taking it as, it's a failure, whether you need your medications or whether your glucose glucose levels are varying. Again, there are so many variables that impact your blood sugars that, again, making sure that we kind of take a big picture approach to this too. So, but I hope everything goes well on Thursday for you.
Thank you. We have another write-in question coming from Christine from Colorado. And this is, I think, because of our previous discussion, but at what point should someone with diabetes begin seeing an endocrinologist? I was diagnosed almost 2 years ago with type 2, and it hasn't come up yet.
Sure. No, and a great question. I do think that, I work in an endocrinology clinic, and, again, endocrinologists, we are short staffed. There's not a lot of endocrinologists in the country. So again, I know that there are a lot of varying kind of approaches to this and conversations, but most endocrinologists kind of like to see those with type 1, those that are, again, more complex, and the primary care or internal medicine, handling those that are maybe just on oral medications or, again, prediabetes, those that are diet controlled. So, again, I think that, I do see plenty of folks that, that see an endocrinologist that aren't on, insulin. But, again, it might be hard to get in to see an endocrinologist. So I guess my very rambling, comment on that is, just my opinion. But I think that, maybe that's a really great question to ask your primary care physician, your internal medicine healthcare provider of, again, what is their opinion on seeing endocrinologists? Or there are so many people that, have, their social network that someone has diabetes. Again, I'd say if that it does bring up, if it's brought up that someone has diabetes, identifying, who they see. But for the most part, we do tend to see that more folks that are not on insulin, that might just be on oral medicines, perfectly fine seeing their primary care physician or internal medicine. Now, of course, I would be remiss that when we think of diabetes self-management education and support, again, the 4 critical times to be seeing a diabetes care and education specialist is, a diagnosis annually, again, for kind of that lube and a tune. So, again, I think it's kind of, combining forces of, if you can't get in to see an endocrinologist, seeing a diabetes care and education specialist, because they could spend a little more time with you as well. But I'm hoping that helps you a little bit. But, again, I'd say, it's such a personal preference, whether someone wants to see an endocrinologist or not. But for the most part, endos are, again, kind of reserving their times for a little more complex cases as well. But Carla, again, I'd love to hear your input too.
So I appreciate you talking about the diabetes care and education specialist. I hope all of you have seen one, because only 10% of the population goes to see one. That's the statistics. And not only do they have a little bit more time to talk with you, and they're usually nurses or dietitians or pharmacists, so they have a lot of expertise and specialty in the area of diabetes. And you could just sit down and talk to them about what your concerns are, being that member of that team. Very approachable people in general. So I strongly support that, and I hope that all of you will, once again, as being a team member of your care, will say to your healthcare provider, whether it be an NP or a PA or an MD or a DO, that you would really like to spend some time with a diabetes care and education specialist in your area. So I underline that. Okay, so we have some very interesting questions coming in. So here is one, and since you are a dietitian as well, very handy today. We have a lot of nutrition questions. So Parveen, you're on. Parveen? Okay, if we can't get her, I'm going to ask her a question. She said, I am having stage 2 kidney issues. Is it okay to eat legumes?
Oh, great question. Yes, it is okay to eat legumes. Again, one thing when it comes to, chronic kidney disease, again, there's multiple stages. And, again, the stage two, you're still, it's acceptable to be eating protein, and again, legumes being a non-animal source, may, be perfectly acceptable even throughout all the stages. So, again, by all means. But remember, legumes are also carbohydrate, and carbohydrate can impact blood sugars. So again, while it's a nice high fiber source, it still comes down to the serving size. But again, having stage two chronic kidney disease is, again, you can still eat, healthfully when it comes to kind of the plate method, dietary guidelines for Americans, all of those things. So great question.
We have a response to one of our previous questions that may be helpful for them. And this is coming in from Mary Ellen from New Jersey. Mary Ellen, you're on the line.
Hello.
Hello.
Hello, Mary Ellen. You're on the line.
Yeah, it was really a comment because the lady that spoke about the pasta dish,
Mhm.
and I just wanted to pass along that I found an organic chickpea pasta that I find is very close to the wheat pasta, and it has fewer carbohydrates, more fiber, and more protein. Considerably more. So if that's of any help to anybody, I wanted to pass it along. Thank you.
Really appreciate that. Thank you. I know in my mind, I didn't want to necessarily, call out any particular, but I'm happy that you can. So, so yes, again, there are lots of alternatives. So again, certainly, taking a spin through the pasta aisle, there are some good ones, but, again, still focusing on the carbohydrate for sure. Thank you so much for sharing.
So I have a question about being part of your diabetes team. Do you think it helps to write down the questions prior to going in so that you're really prepared for that 15-minute visit?
Absolutely. I think that I'm always thrilled when the patients that I'm seeing come in with kind of their list. And in fact, I've worked with a lot of the people that I work with now for almost 15 years, in some, for 20 years. So, they kind of know my shtick, that I like rapid fire questions. So I strongly encourage that, again, you have a limited amount of time with your healthcare provider. And from the moment you leave that visit, and then the next time you go in 3 months, whether you write it down on, a sticky note or in a spiral, notebook, or type it up on your notes in your phone, I would keep track of those because again, remember, this visit is for you. Again, I usually, if somebody doesn't have any questions, then yes, of course, I have my, my usual things that I have to go through, but I would prefer to hear from the person in front of me as to what it is I want them to be directing the visit, not me. And so again, it's important that you do write down all of the questions and kind of keep track of all of those. And certainly if you're not sure what you should be asking, there are other questions like the American Diabetes Association, even on their site, they have some, questions to ask your doctor, again. So, definitely, as Carla already said, when it comes to kind of general diabetes knowledge and kind of learning the specifics, seeing a diabetes care and education specialist can certainly answer a lot of these questions too. Like, what is hypoglycemia? Again, what should my A1C be? Again, what do my medications do? And certainly your pharmacist at your local pharmacy can answer those too. But, again, I would say, specifically for you, all of these wonderful questions that you've been asking today, again, jotting those down and having that is kind of your discussion, list for your visits. But again, definitely, there are no silly questions. So again, it's really important that you're getting your questions answered. So, I would say every single one of you should at least go to your doctor visits with at least, I'd say, 3 questions, but again, I would more the merrier. So yeah, great question. Yeah, questions, and you're the one that should be directing those visits for sure.
Thank you. We have a question coming in, another nutrition question coming in from Michael, and Michael's from San Fernando Valley.
Excellent.
Hello?
Michael, yeah, hello, Michael, you're on the line.
Hi,
Am I on
Michael.
the air? Okay. Yes. What do you think of glycemic index?
Well, that's a loaded question, Michael. What do I think of glycemic index? It's a research tool that was designed to see, again, the impact of certain one food, on glucose. Again, that's the kind of simplified, what it does. Glycemic index, it doesn't paint the whole picture, though, Michael. Again, and one thing is that it doesn't necessarily affect everyone the same way. And then we also have to add the fact that if you're, having perhaps a higher glycemic index food in with a mixed meal, it's going to alter how it impacts your glucose. But still, the fact remains is that glycemic index is just one piece of the puzzle when it comes to meal planning. Again, when we think of, how the amount of carbohydrate is what's going to impact the glucose overall, glycemic index essentially is going to be kind of how quickly it may affect the glucose. So, it's one thing that you can look at, but, it's just, it's a small part.
Well, and I think the other piece to that, as you mentioned, it's unique to everyone. And so one of the ways to see what your own glycemic index is to do a before you eat glucose and then check it again 2 hours afterwards and see how much your blood sugar raised and how quickly. So
Exactly.
that's another way to tell for you what your glycemic index is. Because it's different for everybody. Some people have problems with rice and some people have problems with corn. It's just unique.
Exactly.
Okay, so here's a question coming in online. Once again, nutrition. Why not promote low carb to avoid complications?
Well, why not? I think it's one of many meal plan options or eating patterns that can be utilized for overall diabetes self-management. But the research is clear. There is no one eating pattern that's going to be universally beneficial for all people with diabetes. We have to take into consideration individualized needs and individualized preferences. So all of the research up till now is that yes, low carb can help, but it's not the only one that can help. So again, I think that we have to acknowledge that it's just one of many eating patterns that are helpful. But again, you have to kind of choose what's right for you. Now, of course, I have to say that low carb means different things to different people. And it's very important that low carb does not mean no carb. And we do know that vegetables, fruits, whole grains are all part and parcel to a healthful eating pattern for a variety of chronic diseases. So again, eliminating entire food groups is not the answer either. And so again, I think it's really important that, I know I'm going to sound like a broken record, but definitely seeing a diabetes care and education specialist, but specifically a registered dietitian, because they can help to further individualize what is going to work for you overall.
Great. And here's another one on how to, another question coming in from Kay from Michigan on individualizing food plans. But here, Kay, go ahead and ask your question.
I'm a type 1 diabetic, and I needed to know how important is it to eat 3 meals a day?
Well, I'd say, hi, Kay, Happy New Year. And so that is the eternal question that we've been asking for a very long time. And to be quite honest, unless you're a growing child, 3 meals a day may not necessarily be something that is a requirement. I think that when we look at kind of the psychology of eating and all of those other things, we could have a very long discussion about that, but it really comes down to kind of the healthfulness of the other meals that you're having. There was actually some research that was done quite some time ago that looked at kind of the number of meals, like 1 meal a day versus 21 meals a day. Well, 21 snacks, eating frequently. There is no consensus on which. Again, it's just like the same, of eating patterns. The number of times that you're eating, it needs to be very individualized. And, again, as a dietitian, I'm not a breakfast eater, and so again, I tend to, have, kind of a small snack midday, and then, a later lunch, and then my dinner. So, I think that, it's very individualized. So again, it's not set in stone that someone has to eat 3 meals per day. But again, I have to emphasize, it's about the healthfulness of those meals, and what we're eating, and making sure that we are kind of getting those minimum requirements every day as well. But great question. Thanks, Kay.
So I think we have time for one more question. This is a diabetes technology question. So Minnie is from Alabama.
All right.
My question is, I use the Libre 2, and you have to change the monitors twice monthly. And when I changed the monitor, I used a new Libre 2, and it's not picking up anything. It's not registering or anything.
Okay.
What should I do? What do you think the problem is?
Well, Happy New Year. I'd say I'm sorry that that's happening to you. And, so I'd say you're using the reader to scan your sensors, I'm presuming. So again, certainly, if you did start the new sensor and it didn't scan, it may be a sensor issue. And so I would strongly encourage that you call Abbott Diabetes Care. Again, the 800 number is on the box of your, the yellow box that your Libre 2 came in, and let them know the problem. Because it may not be anything that you're doing, as long as your reader or your phone, is, you've tried to start the sensor, it just sounds like it might just be a sensor failure. So I would definitely give them a call so they can replace it for you.
Great, thank you. Sure. So this wraps up our last question for this session, and a few items before we close. Amy, could you give us 3 takeaway points you want to be sure our listeners take home from today's discussion?
Sure. First, again, it is your diabetes, and your provider visits should be focused around what you are most interested in talking about. Yes, we know that providers need to do a lot of other things, but again, it's very important that this is a conversation between you and your provider. 2, go to those visits with questions. Make sure that you're jotting them down, in between your visits, so you make sure that you capture them and that you're not going to forget them. But 3, again, seeing a diabetes care and education specialist. If you have not already seen one, please make sure that you get a referral from your provider. Because again, that kind of fills in a lot of the gaps, because we know that providers may not have the time to be able to spend to really delve into a lot of things that you need to talk about. But again, this is all a team approach. And it's important that that there's lots of help available for you, as long as you're the center here, and that you're reaching out and making sure that your providers are kind of helping you to kind of connect the dots to get to where you need to be.
Great, thank you. To help you feel confident about your ability to manage your diabetes and heart health, we encourage you or your loved ones to talk to your doctor and dietitian and diabetes educator about your risk for heart disease, stroke, and kidney disease. Go to knowdiabetesbyheart.org and learn more. Register for our next diabetes.org/experts event, and sign up for diabetes education near you. And you can also sign up for ADA's Free Living with Type 2 Diabetes program. Links to these resources can be found on our registration webpage, diabetes.org/experts. Thank you for all the great questions you called in and wrote in with. We are sorry we are unable to get to all of them today in this Q&A event. If you have questions about the event, you're welcome to contact us at askada@diabetes.org or by calling 1-800-342-2383. Please stay on the line for our survey to help us with future planning for our events. Thriving with Diabetes takes a team, and we're here to support you. Special thanks to our expert, Amy Hess-Fishel. I am Carla Cox, and on behalf of the ADA team, we want to thank you for joining us today, and we look forward to connecting with you at our next events. So our next KDBH event is February 14, Prevention and Treatment of Heart Disease and Stroke, and March 14, Prevention and Treatment of Diabetes Kidney Disease. Please visit our website for more information at diabetes.org/experts and register today. If you have any questions about this event, please email askada@diabetes.org. Include Ask the Experts Q&A in your subject line, and thank you for joining us. And now we will go on to the survey. Thank you for participating in the American Diabetes Association Ask the Experts event. We hope that you benefited from your experience. Please stay on the line to complete a survey about the event. Your valuable feedback is essential for us to reach our program goals and improve future events. All responses will remain confidential. Question 1. Please rate the extent to which you felt the event met your expectations. For did not meet my expectations, press 1. For somewhat met my expectations, press 2. For moderately met my expectations, press 3. For met my expectations, press 4. And for exceeded my expectations, press 5. Question 1 again. Please rate the extent to which you felt the event met your expectations. For did not meet my expectations, press 1. For somewhat met my expectations, press 2. For moderately met my expectations, press 3. For met my expectations, press 4. And for exceeded my expectations, press 5. If you think you could use some support to manage your diabetes, check out the Living with Diabetes program, where you can receive email information and e-brochures with tips on eating, fitness, and emotional health. Check out our registration page at diabetes.org/experts. On to question 2. After attending this event, do you plan to attend a future Ask the Experts event? For yes, press 1. For no, press 2. And for not sure, press 3. Again, question number 2. After attending this event, do you plan to attend a future Ask the Expert event? For yes, press 1. For no, press 2. And for not sure, press 3. People with diabetes have a higher risk of retinopathy than those without diabetes. Be sure to get your annual eye exam. Early detection can save your vision. Okay, now to question 3. Please rate your agreement with the following statement. By attending the event, I gained knowledge on the presented topic. For disagree, press 1. For somewhat disagree, press 2. For neither agree nor disagree, press 3. For somewhat agree, press 4. And for agree, press 5. Question number 3 again. Please rate your agreement with the following statement. By attending the event, I gained knowledge on the presented topic. For disagree, press 1. For somewhat disagree, press 2. For neither agree nor disagree, press 3. For somewhat agree, press 4. And for agree, press 5. You can find delicious and healthy recipes and menus to improve your diet. Visit the website www.diabetesfoodhub.org. On to question 4. Please rate your agreement with the following statement. The knowledge I gained is relevant to my loved one's diabetes. For disagree, press 1. For somewhat disagree, press 2. For neither agree nor disagree, press 3. For somewhat agree, press 4. And for agree, press 5. Question number 4 again. Please rate your agreement with the following statement. The knowledge I gained is relevant to my loved one's diabetes. For disagree, press 1. For somewhat disagree, press 2. For neither agree nor disagree, press 3. For somewhat agree, press 4. And for agree, press 5. Did you know that there are approximately 37 million Americans with diabetes? You are certainly not alone. Okay, now to question 5. Please rate your agreement with the following statement. I feel confident that I can apply the knowledge I gained to help manage my loved one's diabetes. For disagree, press 1. For somewhat disagree, press 2. For neither agree nor disagree, press 3. For somewhat agree, press 4. And for agree, press 5. Question number 5 again. Please rate your agreement with the following statement. I feel confident that I can apply the knowledge I gained to help manage my and my loved one's diabetes. For somewhat disagree, press 2. For disagree, press 1. For somewhat disagree, press 2. For neither agree nor disagree, press 3. For somewhat agree, press 4. And for agree, press 5. Check out the heart disease risk calculator at https://www.cvriskcalculator.com and find out if you are at risk for heart disease. On to question 6. Please rate your agreement with the following statement. I intend to use the knowledge I gained in a new or future appointment with a healthcare provider. For disagree, press 1. For somewhat disagree, press 2. For neither agree nor disagree, press 3. For somewhat agree, press 4. And for agree, press 5. Question number 6 again. Please rate your agreement with the following statement. I intend to use the knowledge I gained in a new or future appointment with a healthcare professional. For disagree, press 1. For somewhat disagree, press 2. For neither agree nor disagree, press 3. For somewhat agree, press 4. And for agree, press 5. Did you know that there are approximately 250,000 people in the United States with diabetes-related kidney failure? Talk to your healthcare provider about your risks. Get tested and prevent diabetes kidney disease. On to question 7. Please rate your agreement with the following statement. Attending this event promoted my feelings of belonging and community. For disagree, press 1. For somewhat disagree, press 2. For neither agree nor disagree, press 3. For somewhat agree, press 4. And for agree, press 5. Again, question number 7. Please rate your agreement with the following statement. Attending this event promoted my feelings of belonging and community. For disagree, press 1. For somewhat disagree, press 2. For neither agree nor disagree, press 3. For somewhat agree, press 4. And for agree, press 5. Diabetes education programs provide services that address your diabetes concerns and will empower you with the knowledge and skills to manage your diabetes. You can find a program near you by visiting diabetes.org/experts. Okay, now to question 8. Before participating in this event, how confident did you feel speaking with a healthcare professional about you or your loved one's increased risk for heart disease and stroke? For not at all confident, press 1. For not very confident, press 2. For neutral, press 3. For somewhat confident, press 4. And for very confident, press 5. Once again, question number 8. Before participating in this event, how confident did you feel speaking with a healthcare professional about you or your loved one's increased risk for heart disease and stroke? For not at all confident, press 1. For not very confident, press 2. For neutral, press 3. For somewhat confident, press 4. And for very confident, press 5. Keeping glucose within the target range of 70 to 180 milligrams per deciliter 70% or more of the time is the international recommendation for diabetes management. Consider asking your provider about getting a continuous glucose monitor, otherwise known as a CGM, to help you control and monitor your glucose. On to question 9. After participating in this event, how confident do you now feel speaking with a healthcare professional about your or your loved one's increased risk for heart disease and stroke? For not at all confident, press 1. For not very confident, press 2. For neutral, press 3. And for somewhat confident, press 4. For very confident, press 5. Question number 9 again. After participating in this event, how confident do you feel now speaking with a healthcare professional about your loved one's increased risk for heart disease and stroke? For not at all confident, press 1. For not very confident, press 2. For neutral, press 3. For somewhat confident, press 4. And for very confident, press 5. Physical activity is an important part of reducing the risk of cardiovascular disease and promotes psychological well-being. If you find it difficult to move due to injuries or chronic pain, ask for a referral to a physical therapist to work with you and find a program that works for you. Okay, just a few more questions on more like demographics. We strive to create programs and services that represent the full diversity of the ADA community. We are asking the following questions about demographics to ensure that we are meeting this goal. Gender. Please select which of the following best describes you. For women, press 1. For man, press 2. For non-binary, press 3. And for prefer not to answer, press 4. Again, please select which of the following best describes you. For a woman, press 1. For man, press 2. For non-binary, press 3. For prefer not to answer, press 4. By not using tobacco products, keeping your glucose, blood pressure, and lipids within target levels, you can reduce your risk of developing cardiovascular disease. Okay, generation. Please select which of the following best describes you. For silent, born between 1928 and 1945, press 1. For boomer, born between 1946 and 1964, press 2. For Generation X, born between 1965 and 1980, press 3. For millennial, born between 1981 and 1996, press 4. For Generation Z, born between 1997 and 2012, press 5. And for prefer not to answer, press 6. Once again, your generation. Please select which of the following best describes you. For silent, born between 1928 and 1945, press 1. For boomer, born between 1946 and 1964, press 2. For Generation X, born between 1965 and 1980, press 3. For millennial, born between 1981 and 1996, press 4. For Generation Z, born between 1997 and 2012, press 5. And prefer not to answer, press 6. We hope you've enjoyed this Ask the Experts program and that you'll join us again next month for another session with an expert. Check out our calendar at diabetes.org/experts. Okay, our last question. Please select which of the following best describes you. For African American or Black, press 1. For American Indian or Alaskan Native, press 2. For Asian or Asian American, press 3. For Hispanic, Latinx, or Spanish origin, press 4. For Middle Easterner or North African, press 5. For Native Hawaiian or Pacific Islander, press 6. For white, press 7. And for prefer not to answer, press 8. Once again, our last question. Please select which of the following best describes you. For African American or Black, press 1. For American Indian or Alaskan Native, press 2. For Asian or Asian American, press 3. For Hispanics, Latinx, or Spanish origin, press 4. For Middle Easterner or North African, press 5. For Native Hawaiian or Pacific Islander, press 6. For white, press 7. And for prefer not to answer, press 8. Thank you for answering these questions. Please join us again at the future Ask the Experts event. To learn more, go to diabetes.org/experts. Again, that is diabetes.org/experts. Thank you.